A frontal plane dissection with a little bit of a off-centered sagittal dissection. So we have the skin of the scalp, the bones, again the compact, spongy compact bone of the skull, and now we have the meningeal layers right here. So the first layer of meninges we're going to talk about is known as the periosteal layer. Periosteal, it's around or it's in conjunction with some type of bony tissue. Periosteal layer is the most superficial layer of the cranial meninges, okay? I think there's one question on the modules. It says it asks for the meningeal layer and it puts it right here. We'll just extrapolate. If it's making contact with bony tissue, it's periosteal, okay? Deep to the periosteal layer is the meningeal layer. So we go scalp, bone, periosteal layer, meningeal layer. Now, combining those two together, we create the dura mater. So we talked about the dura mater last week with the spinal cord, and it was just that really tough outer connective tissue covering for the spinal cord. Well, with the brain, we have two layers put together to create the dura mater itself. The superior sagittal sinus, here we have it from the frontal view. When we look at it from the sagittal point of view, we can see that it runs the entire length of the brain itself on the superior aspect. So it gets its name based off its position. The superior sagittal, because we're in the sagittal plane of dissection, and then sinus, because it's a pocket of space allowing for cerebral spinal fluid to flow around the brain itself. So we have the choroid plexus here, the lateral ventricles, third ventricle, coming down the fourth ventricle, and then there's a little bit of a tunnel right here in which that cerebral spinal fluid is then able to be pumped and circulated around the brain itself. The phallic cerebrae. The phallic cerebrae is essentially a fold that occurs when one hemisphere connects or makes contact with the secondary hemisphere. So we have the left and right hemisphere. This fold that occurs is known as the phallic cerebrae. It's also a double layer of meningeal tissue from the meningeal layer of the dura mater. So we have the meningeal layer, and then as they fold down, so it's a double layer of meningeal coating or covering, if you will. Again, just allowing for protection and somewhat of a buffer from one hemisphere to another. But the phallic cerebrae is just defined as that double meningeal fold that occurs within the hemispheres themselves. Subdural space, so subdural, just like the subarachnoid, is underneath or deep to the dura mater. Subdural space or potential space, again allowing for some circulation of lymph fluid especially. If you ever have a patient with a head injury and they have a subdermal hematoma, that's the areas in which you'll hear like bleeding on the brain or a brain bleed. This is the area in which that's occurring. What's not good about that is that if the patient has a lot of blood pooling up in this area, the blood's not going to push the skull out of the way, it's going to push into the brain, and that could potentially cause brain damage or some neurological deficits, or the patient could potentially pass away. And so subdermal hematomas are nothing to play around with. Then we have the arachnoid mater, just like with the spinal cord, those web-like projections that are going to, again, anchor to the cerebrum and allow for, or it's going to stabilize that structure, again, not allowing for too much freedom of movement. Subarachnoid space, again, allowing for circulation of that cerebral spinal fluid. And then the pia mater, which is just like that saran wrap coating surrounding the entire cerebellum all the way down, the cerebrum and cerebellum, excuse me, all the way down the spinal cord, covering every nook and cranny and curvature of that external surface.